Good morning, everyone. Today, the topic of our I'm Dr. Gunjan Bhola. I'm working as a senior consultant in Asian Institute of Medical Sciences. And the topic of endometriosis. You must have heard of many of the times कि endometriosis क्या है, क्या problem है. Sometimes a patient has complaint of pain lower abdomen and especially colicky during menstrual cycles. And it's not explained painkillers and it's normal ovulatory pains. Normal ovulatory pains and after ovulation, yeah, they are endometriosis. These pains are and they are not able to take them. And in spite of taking analgesics and painkillers, the pain is not relieved. So they need to go to a gynae to get themselves checked and to rule out for endometriosis. What exactly is endometriosis? Now my question is, endometriosis is, we can divide it in, we can actually break the word endometrium and oocyst. Oocyst is infection, is the disease, and endometrium is the normal lining of the uterus. So if it's the normal lining of the uterus, then what is the problem with endometriosis? Endometriosis is usually this and with hormones. This layer is built every month in a female, and this is shed in a menstrual cycle. This is the healthy endometrial behavior, and this is seen in the normal menstrual cycles. But sometimes some patients who have blood coming out, sometimes blood can go tubes to different organs. Different organs like ovaries, tubes, even sigmoid colon and can be affected by it, and they can have deposits of endometrium on them. So what is the harm if the blood goes inside? We usually feel that it should get dissolved and everything, and the body has a very good autolytic mechanism, and with enzymes and everything, we should not have much problem. But because this blood affects in a way that it has healthy cells also in it. These cells, they start deposited on these organs, which I'm telling you. I'll be showing you a picture also to tell you which organs can be affected. Right now I'm showing you this picture. In this picture, if you can actually visualize, what I'm trying to say is, this is in the uterus, the lining is in endometrium, which is healthy, and you can see the endometriotic spots or the implants are on the uterus fundus. Fundus is the uppermost area of the uterus. If you can see on the tubes, ovaries, broad ligament, it can have on vagina also, and as I've already told, the other organs which can be affected by, though they are quite rare, but they can be affected. Like sometimes we get a patient that every menstrual cycle, I saw a patient which was quite rare also, but patient had a problem of hemopsis. Hemopsis is खांसी में blood आता है. She was investigated for TB, everything was done, every CT and everything was done, but she had a very particular history that जब भी उसको period आता है ना, तब उसको वो blood आता है sputum में. So that was the link which we were able to make out, that it can be an endometriotic patch there, which is quite rare, because it's not because कि वो, अब the next question is, इतना दूर retrograde नहीं जा सकता है ना flow. So how is it possible? So there are theories related to endometriosis which we cannot explain कि वहाँ पे क्यों है, but these cells, the cells of lungs or the tissue, they started behaving, few cells in hormonally inclined as the uterine linings are. So what I was trying to tell you is कि जो spots उसके ऊपर cells आ जाते हैं, वो cells जो है they start multiplying. Now they start multiplying. They get because they are hormonally induced by the natural hormones which are secreted by our ovaries. That cells start bleeding. But जैसे the endometrium के जो cells हैं, जब bleed normal uterus, they have a way out. The way out is through vagina they come out like menstrual bleeding. But जो deposits हैं जैसे on, as I've already told you, uterus पे या ovary पे या sigmoid colon पे या rectum पे, anywhere which is abnormal, which is not the normal position of an endometrium, if they start bleeding, what are they going to do? They are going to cause blood collection in that areas. It will become painful for a female because that blood is an irritation. With that irritant will actually अंदर सब कुछ रखना शुरू हो जाएगा because your body's reflex mechanism is to कैसे उसको ठीक करे. So in the process the while there is adhesions, because uterus usually is a mobile thing. So जब वो इतना चिपक के इधर उधर चिपक जाएगा, so वो हम females के लिए it will become very painful for her. She can have painful periods. She can have dyspareunia. Dyspareunia is कि after sex with her partner, she might feel a deep pain which is not getting relief. That is also one of the signs that we have to look for. So why I'm telling you this, because obviously the next question is कि कैसे इसको prevent कर सकते हैं? You cannot prevent them, but then obviously if you have some idea about what I'm trying to say is what is endometriosis, then you can go and actually show your gynecologist, to a doctor कि do I have endometriosis? Why do I have heavy cycles and painful cycles? Why they are so painful that I have to actually skip my work, I have to skip my colleges and everything because of that severe pain. So that is one factor which I usually see patients with. So in these patients, what you can do? Endometriosis cannot be just like we can just say कि हाँ endometriosis है तो अभी इसका painkiller दे दो या क्या है. So the management will depend upon, first we have to diagnose whether it is endometriosis or not. I would say the best way to diagnose endometriosis is definitely laparoscopy, but then it's a very invasive thing. We should try to get the history and everything from after history, from the clinical history and examination. You need to examine the patient vaginally, and she needs a good PV examination, sometimes a PR examination also. Plus, there are other investigations which might help in a diagnosis, like ultrasound. Ultrasound gives us a good picture if there is a cyst, which is an endometriotic cyst. Endometriotic cysts usually are, they have a very classical appearances on ultrasound, and they are usually not missed. But that's only if she has an endometriotic cyst. So then ultrasound can help us. There are other ways, MRI can also help us. There are other investigations also. But doing a laparoscopy only for diagnosis is not justified. But if the patient has an endometriotic cyst and she wants it's very painful, it's hindering its activities, and obviously to relieve her pain we need to remove that endometrioma, then we can see other spots also on endometriosis. So there is a question from Aparna: can endometriosis cause miscarriage? Yes, my next now the thing I was going to discuss after this painful period was infertility, or how endometriosis can affect a female's chances of conceiving, and if she conceives, it can increase miscarriage rate. Yes, it can, because as I was telling you earlier, because our cells start to fight that ectopic endometrium which we have at other points. So we release some hostile chemicals which might not be very conducive for a healthy pregnancy. But then we have to find out the reason and how to help the female to conceive and to have a normal family. So for her, we have to first categorize endometriosis. Endometriosis, mild and moderate. If you have done a laparoscopy for any other reason, especially just I told you, for an endometriotic cyst, obviously you're going to look out for other places also. Are there any other endometriotic spots also? So I will not go much into detail, because for us to explain you what is stage 1, stage 2, stage 3 and stage 4 of endometriosis is quite difficult, because I would say minimal, mild, moderate, severe. That's the category. So if you are in a category 1 and 2 of endometriosis, then the options for you is after laparoscopy and everything has been done and the spots have been minimal, the options can be, depends upon the age of the patient. If the patient is young, we can go for an expectant management, and then obviously we can wait for another 6 months. The patient might conceive after being done laparoscopy. But if she doesn't conceive, then for her another options is we can do an IUI for her for 3 to 4 cycles. But for stage, what I would say category 3 and 4, I would say they should go for an IVF, because IVF give them a very good chance of conceiving, and it's a win-win situation for them, because in endometriosis it's not only the tubes which get affected because of the adhesions or the endometrium, which I was telling you, जिससे miscarriage rate बढ़ रहा है and it gets hostile. It's the ovaries also. The ovarian reserve gets decreased in endometriosis. So if the ovarian reserve is decreasing and everything is not working well, it's better to take our full chances of conception, because naturally बहुत difficult हो जाएगा. Suppose अगर आपने जब लेप्रोस्कोपी देखा के अंदर सब कुछ चिपका हुआ है, ovaries are glued back to the uterus and they are sticking with each other, which should be free, because there is a TO ratio. We say tubo-ovarian relationship, or they have been oriented like that, because what is the purpose of ovary? Ovaries is to release egg, and उसके ऊपर ही बिल्कुल fallopian tubes की fimbrias होते हैं जो उसको catch करते हैं egg को, and then it takes it into the tube, and in the tube actually fertilization happens, because the sperm comes from vagina, from cervix, and to uterus to the tubes, and then after fertilization that fertilized thing go and settle in the uterus. So कुछ भी इसमें से relationship अगर disturb हो जाएगा तो obviously conception chances will decrease. और अगर tube आप सोचो कि वो move ही नहीं कर रही है तो वो उसको कैसे लेके जाएगी fertilized egg को वहाँ पर? So that will make a difficult thing for a patient. Now, how thick this line should be and what are measures to take care. So thick lining is, I think Aparna wants to know the endometrium lining. Endometrium lining depends upon the phase of menstrual cycle. If the patient is just menstruating and has just finished with her menstruation, it's her third and fourth day, then 4 mm will be also very good lining. But similarly, for an ovulatory patient, 8 to 10 mm is a good lining. Secretory phase after ovulation, 12 mm, 14 mm is a good lining. And what are measures to take care? I think any thing, whatever it is not only related, because I would not say endometriosis is just limited to, just I have already explained to make it easier to you, कि कैसा हो गया होगा, कि उसका retrograde flow है. But there are other cell theories also, कि some cells change कर जाते हैं अपने आप mutate होके, जैसे मैंने आपको बताया lungs वाले जो है वो कुछ change हो गए और वो करने लगे bleed. So similarly जो ये measures हैं उसमें I would say to have a healthy lifestyle, and you should be aware of कि sometimes people just take it for granted कि मेरे को heavy cycles हो रहे हैं, कोई बात नहीं, मेरे को तो शुरू से ही heavy cycles है. It's not only कि it's going to make you anemic, obviously it is going to make you anemic anyway, but सबसे ज़्यादा ये भी है कि उसके और भी impacts होंगे. It's not only limited to that factor only. So we need to be very conscious about our health, and our health doesn't just means कि I've seen females have a tendency कि जब तक सर के ऊपर से पानी नहीं जाता ना, they don't want to go to a doctor. They feel अभी डॉक्टर को जाएंगे, डॉक्टर दवाई लिख देगी, दवाई के अलग रिएक्शन हो जाएंगे. You need to understand that दवाई तभी लिखी जा रही है because you require it, and it's you are going to take charge of yourself rather than someone else. Someone else is going to tell you कि चलो अब आपको डॉक्टर को दिखा दें. It's high time that females should start taking their part seriously, because if they are not able to take care of themselves, they are not able to take care of their family or everyone around them. So coming back to the topic of endometriosis, as I was telling you, endometriosis, the next question is, how can we treat endometriosis? Treat endometriosis is similarly, जैसे कि अभी I was telling you, the hormones are coming and वो आपका endometrium layer वहाँ पे bleed कर रहा है, जहाँ spots है वहाँ पर भी bleed कर रहा है, so it's making it painful. So painful में उसको ये भी हो सकता है कि during periods उसको लगे कि मुझे मतलब urine pass करने में भी बहुत दर्द हो रही है, मुझे motion करने में भी बहुत दर्द हो रही है, it's unbearable. So it can be कि वो डिपॉजिट जो है उसके यूट्रस के अलावा यूरिनरी ब्लैडर पर भी हो सकता है उसके रेक्टम पर हो, जो डिपॉजिट्स उसको तंग कर रहे हैं। तो अगर इतना पेनफुल है देन ऑब्वियसली दैट पेशेंट रिक्वायर्स अ लेप्रोस्कोपी कि जितना उसका एडिशंस कुछ भी है हम उसको सेटल डाउन कर सकें। सिमिलरली एडिशंस निकालने के बाद में भी कितना भी है बट देयर कैन बी माइक्रोस्कोपिक डिपॉजिट्स जो उसके बाद इफेक्ट करे। सो देयर आर मेडिसिन ऑल्सो विच वी कैन गिव। इसमें क्या है कि वी क्रिएट अ सिचुएशन जिसमें जैसे अ वेरी गुड चेक टू सी दैट पर्सन इज relieved by these symptoms of endometriosis is you can put that patient on OC pills, oral contraceptive pills. So oral contraceptive pills for 2-3 cycles and you will be able to come to know कि अगर उसका पेन उससे सेटल हो गया that means it is something related to her hormonal issue जो उसको वहां पे तंग कर रहा है because when once we start with oral contraceptive pills or other hormonal pills we are basically substituting natural के साथ में हमने artificial को substitute कर दिया। The natural ovaries comes to a rest। सो जब वो रेस्ट पे चली जाएंगी तो ऑब्वियसली उसका पेन बेटर हो गया बिकॉज उसके जो एंडोमेट्रियोटिक स्पॉट्स हैं उनको तो नहीं मिल रहा वो हार्मोन जो ऐसा वाला चल रहा है। सो शी फील्स रिलीव्ड ऑफ हर सिम्टम्स। That is also one way of judging that. But as I've already told, we can put patient on OC pills also, but there are other very good drugs also which we have started giving and which are not that hormonal and they don't have other hormonal side effects with it. So we can try that also. Endometriosis. Should a person have hysterectomy and oophorectomy? Similarly, as I was coming, pills हो गई, medicines हो गई, अगर अब उसके बाद उसको relief नहीं हो रहा and her family is complete and she's so much in pain and agony, obviously hysterectomy with oophorectomy will help and specifying it again and again ऐसे patients में आपको ovaries remove करना है because she will not get relieved by her symptoms if you are only going to remove her uterus because ovaries will be there and they will continue producing the hormones and will affect that patient. So that is the good thing. Can some food products also help in endometrium good lining if someone is planning for baby? Obviously, food plays a good role because you need to have a healthy lifestyle in all forms of taking good fruits, milk, and other nutritious things which are required. But it will help in endometrium good lining if because it's not the only factor which is going to affect her endometrium lining. She has to keep her weight in check. That will also help. And how active and how frequently she is maintaining her health. That's also important. So yeah, I would say there are no. It's not like ये खाने से बहुत अच्छा हो जाएगा. So don't get into this myth psychology. But obviously, a good balanced diet will help in conceiving. So, are there any psychological issues? Yes, there are psychological issues attached with it because a female who will get really depressed, especially when she's missing out on all her activities because of this severe pain and her relations are getting affected with her partner because of severe pain during her sexual sessions. So, she will definitely be psychologically stressed. Patients should be not only dealt by giving them medications. They have to be, the doctor has to be comfortable. They have to make her comfortable and she has to develop a bond with her doctor so that she is able to tell her what exactly she is feeling so that she get a proper help and it should not be only physical symptoms we are treating the individual as a whole and her psychological needs are equally important. So endometriosis can be cancerous also. Endometriosis converting into cancerous is it's quite rare. It's a rare possibility. So but yeah, we need to check but इसके डर की वजह से कि endometriosis है so we just advise a patient to get a hysterectomy and oophorectomy done. It's not justified anyhow. But endometriosis does losing weight helps in endometriosis? No, endometriosis not related to weight loss, but definitely if that endometriotic patient is planning to conceive, then weight loss will help definitely. But losing weight में endometriosis की lining पे कुछ फर्क नहीं पड़ रहा, but obviously इसमें जरूर फर्क पड़ रहा है. अगर वो ज़्यादा bleed कर रही है, she is not keeping well, her anemia, she has anemia, तो उस losing weight का it's not going to be helpful. It's actually going to be detrimental for her health. So we have to take that also into account. Endometriosis patients may, as I was discussing with pregnancy is good for endometriosis, but endometriosis can be bad for pregnancy. So what I'm trying to say is कि जैसे मैंने आपको बोला, ovaries is given rest by medicines or by surgery. Similarly, in pregnancy, it's a pseudomenopause state. बिकॉज आपके ओवरीज रेस्ट पे चलेंगी तो एंडोमेट्रोटिक बाकी पेन्स वगैरह सब सेटल हो जाएंगी एंड इनफैक्ट दे माइट हील आल्सो ड्यूरिंग द टाइम क्योंकि थोड़ा उसको फेज आउट पीरियड मिल जाएगा. बट एंडोमेट्रोसिस कंसीव करने में डिफिकल्टी करेगा बिकॉज इम्प्लांटेशन में प्रॉब्लम करेगा, इवन ट्यूब्स में भी. आई वांट टू शो यू अ स्लाइड. In that the slide you will be able to see कि how it is affecting fertility in a female. So the slide will basically show us that the egg reserves are compromised. Tubes are obviously not that mobile and they are restricted because of the adhesions. As you can see, distortion or blockage of reproductive organs. So embryo implantation problem because the endometrium lining is hostile. And journal inflammation. Journal inflammation means जो मैंने अभी बोला कि inflammatory mediators इतने ज़्यादा body में चल रहे हैं because the natural reflex of our body is anything which is not normal, our body will try to bring the cells against it and will try to destroy it. But in the process of destroying, वो जो inflammatory mediators हमारी body produce करती है, वो भी inflammation हमारी body में और increase करेंगे. So decreased egg quality, especially it's a very growing concern these days कि अगर patient with endometriotic cyst, she's not having much symptoms and she wants to conceive, comes to you, do you need to remove that endometriotic cyst or just treat her for her infertility and try to make her conceive? So it's very controversial because there are people who say कि वो cyst निकाल देनी चाहिए and then we give her a fair chance. But there are patients and there have been studies which are showing कि जब वो cyst निकाल देते हैं patient में जिसको उस टाइम पे इतने symptoms नहीं थे, the cause of concern was not that endometriotic cyst at that time. She was not having that painful her main complaint not pain or severe dysmenorrhea, I would say, और severe pelvic pain उसमें नहीं थी उसकी cyst के साथ में और वो आपके पास में conceive नहीं कर रही थी इसके साथ में है और आपने ये देखा कि उसके ऊपर एक बड़ी सी endometriotic cyst भी है. आप उसको निकाल देंगे पर उसका ovarian reserve can get compromised. That has become a topic of discussion these days with the infertility specialists and people are advising that you should not remove that cyst and should leave it for a while till she is not symptomatic for that cyst and we give her a fair chance to conceive. We should not compromise her ovarian reserve at that time. So I think that is one concern that we need to see. What happens if my wife gets pregnant with endometriosis? She will need extra precautions from her doctor also. She might need some medicines which to support her pregnancy. It can be in the form of injectables. We usually give progesterone supplements in other forms. And she needs to be extra cautious with that because as I've already told, endometriosis can cause miscarriages. But otherwise, for endometriosis, pregnancy is a very good thing. So if she continues with her pregnancy with all the precautions, her endometriotic problem might also get some relief. What can help with endometriosis pain? Endometriosis pain, yes, endometriosis pain, obviously with any dysmenorrhea, and dysmenorrhea is basically known as pains which females have during their menstrual cycle. What exactly can work? Hot heating pads obviously can work. Analgesics, there are different types of analgesics. Initially they were mefenamic acids. Now they have drotavirins also, which are working for it. And you need to consult your doctor for that. Obviously, she will prescribe you how to take and what medication medications can help. And other things which can help is because with the endometriotic pain, patients usually don't take adequate liquid and food, so you have to increase your balanced diet, and you have to take care of your hydration well. So this will help in relieving her pain. If it's not getting relieved, then there are therapies like TENS and uterosacral nerve ablation. But I would suggest first let's go with the basics ones, and then we can come to a solution. What works best for that female? What happens if my wife gets pregnant with endometriosis? We've already discussed that. I think surgery, when is surgery needed for endometriosis? Endometriosis, as I've already told, only for diagnosing endometriosis, a diagnostic laparoscopy should not be done. Should not be done. Why it should not be done? Because patient ka agar surgery is required for endometriosis now. It's not like we should not do a surgery. As I was telling you early, suppose the patient is planning for conception, and there are other factors also to consider. In that cases, you need obviously laparoscopy to see that everything is fine. Similarly, if her endometriotic cyst, that we say is endometrioma, is causing her a very painful periods, and she has then she's incapacitated by her pain. She's not able to move around much. Then obviously she needs a surgery to be tackled for. But then only doing surgery just to diagnose is not done. You should try other methods first. I think it's a very vast topic, but I have just tried to, why the reason why I wanted to discuss endometriosis was because I think there were so many views which I felt with my patients that they were not able to get a clear picture actually, what exactly is endometriosis? Why do we endometriosis has to be treated? Why it should not be treated? Why it should be left? And what, because today I feel if you tell a patient that आपका endometriosis is 3 and 4, that you should go for IVF, तो उसको लगता है कि अरे सीधे मुझे IVF बोल दिया, मैं कैसे IVF करा लूँ? You have to understand IVF is not a taboo. It should not be done like a taboo. If a patient requires IVF and if your doctor is suggesting, obviously you can take a second opinion if you're not convinced. But if she is suggesting you that and she feels that you will get better with it and you'll get a good result, I think you should take it rather than going so late. Because usually क्या आजकल लोग IVF में जाते हैं जब वो 40 years से पहुंच जाते हैं. Don't make it so late कि आपका ओवेरियन रिजर्व उतना कॉम्प्रोमाइज हो जाए कि आपके IVF स्पेशलिस्ट को आपके लिए ओवरसाइट डोनर लेना पड़े. It's about you, it's about your family, it's about your needs. So you have to understand what is important for you. So I think it's time for me to wrap up this topic, though I would really love to discuss more. But I think I've almost touched all the points which needs to be emphasized. If you want to discuss something further, then we can obviously have another session whenever you want. Thank you so much.